Hi, my name is Lenore, and this is my presentation for Developmental Psychology 1 on birthing practices and early childhood care around the world. First, we're going to talk about birthing practices around the world and how they vary. So we've talked about this in our course already, so I don't want to spend a whole lot of time on it, but cesarean section rates are very different around the world. Our worldwide rate is about 21.1%, and it's supposed to be sitting at around 10 to 15% because this represents when women who need them are getting them as required, but that they're not being done electively and unnecessarily. And the worldwide rate in 1990 was just 7%. It's increased quite a bit. In this bottom corner, you can see the rates for different continents, and the ones highlighted in yellow indicate that there are dramatically different rates for different parts of those areas that I will touch on in a moment. So the big problem with high cesarean section rates is that first and foremost, it's a surgery, so it has a lot of complications that it can present to the mother, and it delays skin-to-skin contact and breastfeeding between the mother and the infant. That's because cesarean sections take a long time to recover from. They're typically done while the mother is unconscious, so the baby's taken away and it just delays this whole process. And having this surgery done can lead to future pregnancy risks and reduces the ability for vaginal births in the future to be done successfully, and we'll have to likely repeat the cesarean section with further pregnancies. And like we discussed in class, there is the possibility of it just being done too early for elective C-sections. You want the baby to have the full time to develop. And in these countries here on the side, it's more common to have a cesarean section than a vaginal delivery. And those are Egypt, Dominican Republic, Brazil, Cyprus, and Turkey. And we also have some very concerning low rates. In sub-Saharan Africa, the rate is only 5%. And in parts of Oceania, the rate is only 3%. And this is very concerning because vaginal birth just isn't always an option. So in the case of things like abnormal position, prolonged labor, and fetal distress, these are necessary procedures. And in places where they can't be done, there is a risk of the mother, child, or both dying in this process. On a similar note, we also have induced labor. It's becoming more prominent in many parts of the world. In industrialized nations, about 1 in 4 births are performed via induction. They're higher in parts of Europe and in Sri Lanka, and in the parts of Africa that were studied, primarily the northern areas, it was only 3% that were induced. And it can be done electively, which faces a lot of the same problems as elective C-sections of just being done too early. But it also allows women who live very far from their clinics to schedule their birth so that they can have it in a clinic in a more controlled environment instead of risking having it at home. But medically, these also help with post-term pregnancies and maternal medical complications such as preeclampsia. And this just increases the chances of the mother and the infant both doing well. And the biggest thing that I found in differences around the world is where births are attended by healthcare professionals. This map was taken from UNICEF data directly, and you can see that it's extremely low in some areas. And the difference in communities is astounding as well. Urban women are 20% more likely to have an unattended birth or an attended birth. And differences in wealth also cause a large difference. And in some parts of the world, they're almost twice as likely to have an attended birth if they are more wealthy. Going back, sorry. And this is really important just because it reduces complications. There's someone there to help. And institutional deliveries are also very important. These are deliveries that happen in clinics or hospitals. You can see the rates here for different parts of the world. And these are even more important because it just makes sure that if something goes wrong, there's a whole team there ready to respond. These are also super important in cases of preterm birth because the baby is likely to have a lot of complications. It will likely need oxygen and an incubator, and those are not available with home births. And a lot of the risks do include that only 64.9% of home births studied showed that the women met all requirements to be considered low risk. And that means that these are moderate to high risk women giving birth without the attendance of a doctor. And like I mentioned before, preeclampsia, preterm births, and post-date pregnancies can all be issues. And in the issue where it's needed for C-section to occur, these just cannot be done at home. And after the baby is born, there is a lot of difference in how people raise these infants in the first couple of months of life. Breastfeeding is something we also covered in this class, and I would like to touch on it again here. It's recommended that breastfeeding is done exclusively for the first 6 months and along with proper solid food until the second year of age. And formula is a great alternative to breastfeeding when it's possible and when breastfeeding is not an option. And it's more prominent in high-income countries for women to use formula. And we did discuss those previous points before in this class, but I wanted to talk more about which to choose and how women really make this decision. Breastfeeding has a lot of advantages because it's free and doesn't require clean water, and it also doesn't require washing or preparation. This makes it a very good option in poorer countries where the water could be contaminated or where the mother won't be able to sanitize bottles appropriately. Whereas formula gives a much more flexibility, doesn't restrict the mother's diet, and it's convenient because non-mother caregivers can give formula. So this allows fathers, grandparents, adoptive families to all feed their baby effectively. And depending on the needs of the parents, it makes a big impact onto which one they will choose. However, breastfeeding is the recommended option because it has more nutrients and antibodies, and it's significantly easier for the baby to digest. Some other cultural impacts on feeding is the idea that old milk is dirty milk is found in some places. They believe the first breast milk that a mother produces is either dirty or old or it's fake milk, so they'll withhold giving it to their baby. And this can lead to these babies not being breastfed for the first 48 hours of life, which is concerning because they need the skin-to-skin contact that comes with breastfeeding, and they need the nutrients once they're born. Another one is that a plump baby is a healthy baby, and this results in some babies being overfed, and they will be fed both breast milk and formula so that they will be plump. Another one that is a little less impactful is the idea of not feeding after a fight. In some cultures, it's believed this will taint your breast milk and cause problems for the baby. So if women have been in an argument, they will not breastfeed until they have gone through ritual cleansing. And this can be a problem if they get into an argument or have a high conflict life because it will delay the baby being able to get food. And a big one, especially in Western world nations, is that the breast is over-sexualized. Babies need to breastfeed in order to receive food in most cases. And because the breast is so sexualized, it can be seen inappropriate for a young toddler to be receiving breast milk, so mothers will stop breastfeeding very early as opposed to the recommended full 2 years. And some interesting cultural practices and how women raise their babies around the world. In Bali, they don't allow the newborn to touch the ground for about 3 months of life. This is because the babies are seen to be a gift from God and you don't want to connect them to earth yet. And the first time you place them on the ground, it's seen as them becoming fully human. Many Nordic countries will place their infants outside to nap because the fresh, cold air is believed to help them breathe better. While this does sound weird to some people, we do practice similar things like that here in the United States, especially those of us who live in winter areas. Parents will often start bringing their babies out to play in the snow their first winter. And in Trinidad and Tobago, placing money in the infant's hands is done as a sign of prosperity. This is mostly fine, and it can help with motor skills because it helps with grasping. However, money is dirty, so it can be a little concerning because of the amount of bacteria that they come into contact with. In Pakistan, they shave the baby's head after 7 days, and then their parents are given the equivalent weight in either gold or silver. Overall, not a particularly harmful tradition, while an interesting one. However, shaving can cause abrasion, which could be bad for the baby's head. And in Guatemala, it's believed by some people that ice baths are good for the baby's health and fitness. This is a little bit concerning just because we don't want to lower babies' body temperatures too low, but overall, it's not a super concerning practice as long as it's done monitored. And some really helpful cultural practices are in Finland, mothers are given a newborn baby box. This includes things necessary for the baby and also toys. As we know, toys help a lot with motor development and learning, so those are nice. And it just makes sure that all mothers have a good start and an equal playing field for their babies. And the box actually even turns into a bed, so there's a safe place for the baby to sleep. In Canada, home nurse visits are very common, where a nurse will visit your home intermediately, depending on the area, within the first couple of months of life. And this allows them to continue checking on the baby and making sure that they're doing okay. In South Korea, there's also something like a postpartum spa. It's a medical clinic that does offer massages and baths for the mother, and it also allows the baby to be monitored in the first months or so of life. And another big thing that we did also talk about in class is paid leave being super helpful for mothers. This allows them to spend time at home with their babies and give them the care that they need, as well as breastfeeding them. And the most paid leave in the world are offered in Bulgaria, Greece, United Kingdom, Slovakia, and Croatia in that order. And some conclusions that I've concluded during this research is that birth and infant care is actually very similar around the world. Overall, we have very similar practices, and most cultural differences, like traditions of not placing the baby on the ground, don't have a ton of impact on the baby, and it doesn't cause much delay, so they're really fine in every way. But most of the big differences that we see that have a large impact are caused more by disparities than they are by choice. Breastfeeding is more common in poorer areas because they are unable to get a hold of clean water to make formula. And in the industrialized world, women are not always able to get time off of work to spend with their baby, so formula is the only way their children can be fed. So these kinds of disparities really do need to be addressed worldwide to allow more mothers to get access to proper health care, and so that they can be home with their babies to give them the care that they need. On the bottom of each of the slides, you will find a number indicating which source was used, and here are all of the APA citations for the sources. These are links to all the sources. I will post the PDF in the description of the video as well as in the class module. So you can click on these if you want to see exactly where I got this information. Thank you so much, and I hope you found this as informational as I did writing it.